Hey guys, so we are back. Had to bring Lisa back to the hospital because she spiked a fever yesterday, about 103, and she's supposed to come into the hospital if she has a fever. So I'm going to let her explain everything that's going on and what basically led up to where we are right now and what's happening right now. It's a lot going on. So just want to also say thank you guys so much for all the prayers. We really, truly do appreciate it. And it means more to us than you guys will ever know.
Hey guys, Jen and I are back at the hospital, and this is not fun because we just left here 2 days ago, or 3 days ago, I'm not sure, I'm losing track of time. However, I had a fever at home and I wasn't feeling well again after being home for a few days. So according to my doctors, if I even get 101 fever, they tell me it's a red flag, you can go back to the ER and get checked out, which we did, which is good because it indicates something's going on that's not quite right. So here we are, another couple of days, and it just gets better. So it turns out I'm back for what I was here for before, called diverticulitis, or an infection down in the gut that can be very dangerous if it reminds me kind of not exactly, but kind of an appendix story where it could burst and then it could spread in your abdomen and wipe you out. So it's very important to get in and get treated. I have, look at the artwork up here.
How many bags do you see?
So we have, this is IV fluids, and then these little bags behind are antibiotic. So they're going. So that's how they treat you, because I'm trying to think what else they do. Mostly the IV, I guess. Once in a while there's a pill thrown in, or a shot. They put things in these IVs too, intermittently. But anyway, we're here for a day, for 2 days, we're not sure. I had a head scan, I had an ab scan, and we had a little bit of a trauma story.
A little bit?
A lot of it. So they give me a pre-med before the scan that they use iodine, like they call it contrast, because I'm allergic to the contrast. Of course, they're always like, "What? Why are you allergic? What's your symptom?" I was like, "It's been years ago. I don't know. I don't want the iodine. If you have to give it, you're going to have to give me a pre-med." So they did. Before my last scan, we had a medication disaster. Horrible, horrible.
Pretty much a crisis.
A crisis. And they didn't know how to fix it, almost. So when I get contrast, they call dye before a CT scan. It shows more detail. They have to give me a pre-medication. So it's like, this is called Solumedrol. It's like the effect of prednisone. It keeps you from having a reaction, or if you have one, it keeps things cool. And then this time they also added Benadryl. Well, from the beginning, I knew something was not going to go well. So they actually inject that in the IV tube, both of those. It burned so bad, which never happened before. It burned all the way up my arm, kept burning and burning. They're like, "Oh, it'll wear off. It's just the, they had a couple excuses. It's cold, or it's the tube, or it's your arm." I'm fine. So they gave me that. And it wasn't that long for that to set in. And then they took me down to the radiation for the scan. So they get there and then they inject the dye. It burns even worse. It burns all over my arm, like constant. Like it didn't, usually it'll burn maybe a little and then go away. Now this kept burning in my arm. They're like, "Oh, it's fine. It'll, blah, blah." And I said, the other problem is, after they gave me the Solumedrol, or the pre-med and the Benadryl, my legs, which indicates an allergy, just started like aching and twitching, and the muscles hurt, and it was awful. And like I was like, "Guys, I'm gonna have to hold still." And I don't know if you guys have ever had like that aching leg or restless leg, but this is like 10 times worse. And my legs were literally just, and then it started up my arms. Well, you don't have to hold still that long, but it was that bad that I couldn't 100% hold still for the scan. And I did my best, and then the scan lady comes out, she's like, "Never mind, you're moving and I can't get a picture. And I was like, I told you when I got here, there's a problem, you know, and you didn't listen. And I knew moving around was going to mess up the picture. So she took 2. I was like, well, can you take another one, or should I get some meds and no, I already took 2, and that's a lot of radiation. And I was like, what? She's like, I'm not taking. She was mad at me, okay, because of their mistake up at the room. I was so mad. I was like, seriously? But they did get some kind of written result papers. The doctor read them off the next day. They must have got something.
So listen, when I tell you that Lisa was talking to the doctor had come in to check her out in the ER, and she literally could not hold still. She almost kicked the doctor in the face multiple times. And I'm like, Lisa, you really got to sit still. She's like, I can't sit still. My muscles are twitching. I can't control it. And I'm just like, wow, like this is really bad. Like it was horrible just having to watch her go through that. They literally had to give her, I think it was called Ativan. And then also they gave her an IV muscle relaxer called, I think it was methocarbamol. That's one that I actually had taken previously for muscle spasms. But it was really crazy.
So after the scan, that nightmare, I got back to the room. Even the guy pushing the cart, pushing the gurney, seemed mad at me. I was like, really? Do anything. So finally I asked the nurse, and then she asked the doctor to give me something. Like Jen said, they gave me the IV, the muscle rock. It didn't do anything. And then they gave me the, I think it's called Ativan. It's like, she's like, that'll calm your nerves and everything. So eventually it did kick in. It probably took a half hour.
It took at least an hour.
You think an hour?
After they gave Lisa these medications, and when they finally kicked in, there was no waking her up. Like the nurses would come in and try to talk to her, and she wouldn't even wake up. They literally would have to grab her and shake her to wake her up, and that would last for a minute, and she'd be right back asleep. So I'm like, she's really exhausted. You know, she's just been through an ordeal. So anyway, the nurse comes in last night and let it slip that there had been an error made in Lisa's chart, and she was like, how much does she weigh? And I said, about 122. And she says, oh, well, they put her down as being 200 pounds in the ER. So I was like, well, I told Lisa, I said, that means that they were giving you the wrong amount of medication because they go by weight. So if I find this to be true, we're gonna have a problem here. That would explain why she had such a horrible reaction, you know, if they overdosed her. So why don't you tell them where we are now? You saw the surgeon came in and spoke with you this morning. About what might happen.
So I made it through that last night, and then this morning well, he was called a surgeon PA, but he deals with surgery for this diverticulitis. Things like where they take part of the colon out and all kind of fun stuff. So
okay, so basically there are 3 possibilities that's going to happen here. Number 1, the antibiotics will work and it will resolve the entire situation. The diverticulitis will never go away, but the infection will. So we're hoping that that's the case, and then she just stays in here a couple of days on the antibiotics, and then, you know, problem solved. Hopefully we don't have to deal with this again. We'll see. Second scenario is that they will have to go in and do, it's basically a procedure that they'll do in her bed, but not in this room. They'll do it in another room. And I forget the exact word for it, but basically they're gonna have a radiologist there with a sonogram. They can pinpoint exactly where the infection is, and they'll place a drain. That sounds like that's very minimally invasive. Well, it's still invasive. However, it's a lot less invasive than the third option, which is a bowel resection, which is terrifying. And we really are hoping and praying, and we ask that you guys please pray for us that this does not happen. You know, it would really be nice if it would just resolve through the antibiotics. So, I mean, honestly, if you ask me, they let you leave too soon last time. If they knew that this was an issue and this could balloon into something like this, there's no reason they should have told you about that.
That's what I
And
said.
said, hey, you know, I know you want to go home. Everybody does when they're in the hospital. However, there's a possibility that we haven't killed the infection and it can become a lot worse.
Mm-hmm.
And they didn't tell you that. They acted like everything was hunky-dory.
So we went home not knowing I still had an infection because they cleared me like, oh, you're fine. And when I'm back in here to this trip, I'm like, is there a way to tell it's going? Oh, not really. Like blood tests. And I'm thinking, how did they know when I went home last time?
Right.
So the next fun thing is.
Honestly, I think they were just going by your fever.
Oh.
That's what I think. And here's the thing. Lisa's been in here before for these infections before she had the lung infection. She was in the hospital no less than 5 days. It was between 5 and 7 days when she would have an infection. That's how long she would be in the hospital. See, look at her. She's falling asleep. She can't keep her eyes
I'm so
open.
sleepy. So here's the thing. Like, when they send you home, and you've had now what's upscaled the explanation to a life-threatening infection, which before we weren't using words
like that.
Alarmist words like that. Like, what's the deal? Like, I was like, well, what do you do at home? I mean, blah, blah, blah. I mean, you have pills and all, but apparently it's not as effective as. This is the Tower of Health, I guess. And,
Well, okay, so the infectious disease doctor did come in. She's amazing. We've had dealings with her before. She helped Lisa get through the lung infection.
mm-hmm.
She did say there's a possibility, and I want to know if you guys know anything about this, if you've ever experienced this. There's something called a PICC line. And it doesn't sound pretty, and it does sound like it could be something that could get infected. However, you would be able to receive IV antibiotics from home. And we did actually reach out to her previously to this and talk to her about that, remember?
Yeah.
And she said she doesn't usually do that.
Right.
Although she kind of did offer it this time. Because the only way Lisa's going to stop having these recurrent infections is if she starts on the immunosuppressive therapy, which is basically a chemotherapy drug to knock out some of her white blood cells so that she can have the neutrophils, which you have to have a balance or it's just your immune system's not going to work. So I don't know. It sounds like that's an option. I don't know. It's just so hard to know where to turn.
Okay, and then on top of it, the doctor we were just talking about that came in about the diverticulitis and you could have surgery and all that. So he says, nonchalant, okay, new diet. Basically, you can't have anything to eat or drink for a couple of days because they want to watch this infection area and not have it irritated because guess what? It's in your gut, and guess what? That's where the food goes. So
Right.
all I get is one of these to wet my mouth because you can't even have water. Can't have ice cream, nothing. Yep. I was like, are you kidding? And I'm diabetic. I was like, how does that work?
So you know what they do? They put sugar in your IV. That sounds so healthy. Look at her, guys. She's so sleepy.
I can't believe that stuff's still working on me.
I mean, you're exhausted. You've just been through it, you know?
And no water, no food.
It's awful because she had this, basically we had a stomach virus last week and that's what started this whole thing. So I don't know if that just found its way into a little pocket in her colon and decided it was going to settle in there and that's what happened. That's how the infection started, maybe. But we both had it, so both of us were very nauseous and just feeling pretty sick. Didn't eat much at all last week, so
Eating, sleeping.
finally she has an appetite and she can't even eat. So it really sucks. The whole situation does. But again, I want to send a shout out to Raptor Mama because Raptor Mama has been helping us with our pets again. And I have to go home. I stayed here last night in this chair where Lisa's sitting right now, and it is not very comfortable for like all night. I maybe got an hour's sleep, and that was this morning. I'm exhausted. I need to go home and get some rest. I have a cardiology appointment tomorrow because I'm having problems with my blood pressure. Gee, what a surprise. All this stress.
I was like, you need to go get that blood pressure checked.
All this stress is causing problems.
You used to have normal blood pressure.
Well, we used to have healthy situation too.
Yeah, I had normal white blood cells too.
I know.
But not now.
It's crazy to me that just started 6 months ago.
Right.
And you're having so many problems already.
Right.
But the doctors seem to think that as soon as she starts taking this immunosuppression, they think maybe a month or two, and she'll be back to normal with her health.
That will be amazing.
It'll be amazing, and I can't wait for that day, because y'all know we're going on some adventures. I want to hear you say it.
What?
Raptor adventures.
Raptor adventures. I'm ready to get out of here and have some adventures.
Right? I said, listen. I was like, you ain't going out like this. Like, you're going to go out by the tooth of an alligator or a shark, maybe, but not like this, okay? Right?
Yeah, this is the not a dream way to go.
Heck no. All right. Well, guys, thank you for all the love. Thank you for all the prayers. We truly appreciate it. We will keep you updated. It actually was Lisa's idea to make this video. She was like, let's let everybody know what's going on, how I'm doing. And, you know, thank you guys for all the wonderful comments that you've left. And, you know, thank you for your prayers. We love you guys so, so much. And we'll see you soon.
See you next time. Hopefully I'll be up and going.
Yeah, she gonna be all right.